Hi, I'm Dr. Jeanine Downie. I'm a board-certified dermatologist, and I'm here with Healthline to talk about building a skincare routine for dry skin. So what is dry skin? A lot of my patients will say it's itchy, it's irritated, it's dehydrated, it can be reddish, it can be hyperpigmented, which is darker skin. But dry skin usually means you're not producing very much sebum, so you can get scaling, itching, and cracking. Possible causes include genetics, the environment, hard water, excessive washing, and exposure to irritants, as well as medical conditions like eczema, hypothyroidism, or diabetes. Patients that smoke really can dry their skin, and that smoking, vaping, and smoking weed can really irritate dry skin. Dry skin can lead to cracks in the skin barrier and possible infection, so please be vigilant and gentle with your skin. In terms of routine for dry skin, first, you want to cleanse twice a day regardless of what skin type you have. Choose a hydrating cleanser that's a non-foaming, gentle cleanser that's usually best for dry skin. That way your skin is not stripped, it doesn't get irritated, and you have a nice moisture cushion behind. A water-based cleanser that removes dirt and oil without any disruption of the outer skin layer is what you're looking for. Good ingredients to look for are hyaluronic acid and glycerin. Product recommendations that I really think are strong for this would be the Cetaphil Gentle Cleanser. I recommend using your hands or a washcloth, not a loofah. After cleansing is when you want to put your serum on. Serums are a thin topical formulation with a high concentration of active ingredients to target specific skin issues. I want you to look for hydrating ingredients. Humectants like hyaluronic acid and glycerin work by pulling moisture from the air into the skin. Beware, if the air is low humidity, it may pull more moisture from the deep layers of your skin, resulting in drier skin for the longer term. So it's best to mix with other hydrating ingredients. Now, I do recommend actual humidifiers to be plugged into your bedroom October through April in the Northeast, but if you're in a very cold part of the world, then perhaps the humidifier is running all the time. I really like the Skin Medica HA5 in terms of a hyaluronic acid moisturizer because it moisturizes the skin with 5 different types of hyaluronic acid. Retinoids, you want to look for hydrating retinoids because it's a great anti-aging ingredient, but some of the retinoids can be more irritating. And perhaps if you have dry skin, you're only using those once a week. Other anti-aging antioxidants and brightening ingredients are available to you, but you've got to avoid using harsh chemicals. In terms of vitamin C, it can boost collagen production, fade hyperpigmentation, and decrease fine lines and wrinkles. But higher concentrations of vitamin C, like 15% and 20%, may irritate dry skin. So a combination of hydrating ingredients like glycerin may work, or certain forms of vitamin C, like ascorbyl glucoside. Avoid mixing these with retinol or other exfoliating ingredients. I do like the Obagi, the 15% vitamin C, and that's one that I recommend because it's in an oil-based formulation, so it's not too irritating, perhaps to use once a week. Niacinamide is another option. It's anti-inflammatory, and it can help to retain moisture in dry skin and help to foster some natural ceramide production. After cleansing and putting on any serums, you want to moisturize. So you want to look for something that's non-comedogenic, that is non-acne forming, that will not clog the pores, will not block the pores, and will not break you out. You want to moisturize twice a day. So you might want to use lighter formulations in the morning and perhaps a heavier formulation with a little bit more oomph to it at night. I do love the Neutrogena Hydro Boost Water Gel. I think it's a great product and it does not clog you, but it will hydrate you. Lotions, creams, and ointments are available for use. Now, lotions have more water than oil, and creams have a higher oil content than water. Ointments obviously are occlusive and have the highest oil content, and that's best for severely cracked, dry, and dehydrated skin, or skin that has a flare of eczema or psoriasis. So you actually have dry skin flares on the face, then you're going to need to use occlusive ointments. Now, occlusive products can be other products like Vaseline or petroleum jelly, some silicones, some body butters, and petrolatum, and mineral oil are occlusive and can be great at night, but not so great during the day, and not so great in acne-prone areas. and they coat your skin or your lips with a thick, oily film that can seal in the water and lead to less cracking and greater hydration. You want to think about using occlusive ingredients, especially for non-facial areas. Emollients fill the spaces between their dry and cracked skin cells with lipids. So you want to use emollient-rich moisturizers for dry spots. And if your skin is truly irritated and you have some cracking or some chapping, then you might want to use lipid-based products there. Ceramides are really important in terms of hydrating your skin and are found in a lot of thicker moisturizers, some oil-based and some oil-free. For sunscreen, every single day, rain or shine, January through December, sunscreen with an SPF of at least 30 or more that's broad spectrum protection blocks both harmful UVA and UVB rays, and that's very, very necessary. I recommend reapplication, a minimum of every 2 hours if you're in the Northeast, and if you're down by the equator, then it's more like once an hour. So you want to use moisturizing formulations of sunscreen. I love the Isden Aerophytona actinica that actually repairs your DNA damage from the sun from years gone by. I like Aveeno Protect and Hydrate, SPF of 60. It can go on first or last. I just want to get it on your face. And if you shave your face, like many, many, many people do, Aveeno Shave Gel, Edge Gel, and the Gillette Foamy Sensitive Shave Gel are 3 of the best on the market. Make sure that you don't press too hard and make sure you don't use a dull razor. Post-shave, use an anti-inflammatory like hyaluronic acid and an SPF of 30 or more. Best practices. Stay hydrated. Consider a humidifier in the cooler winter weather months. Shower and wash with lukewarm water. Really hot water irritates and dries out your skin and causes inflammation and irritation. And it can also flare if you have rosacea, that is red patches on your face. And if you have acne, of course you can have acne with dry skin, by the way. Avoid heavy products like oil-based lotions. Go easy on drying ingredients like benzoyl peroxides and salicylic acids and retinols. Avoid harsh products like self-chemical peels that you buy from the internet. Every dermatologist's worst nightmare. Alcohol, as well as fragrance. A lot of my patients come in and they have really significant irritations to fragrance. Preservatives, especially a long list of preservatives, can really irritate the skin. Harsh exfoliants can as well as retinoids. Now, if you want to exfoliate, you can use a gentle alpha hydroxy acid that's not too strong a percentage. Wear gloves when you're working with any harsh chemicals or using a lot of water, that is washing the dishes, cleaning up around the house, quite frankly, even watering flowering plants, because a lot of the flowering plants, the residue can get on your hands and irritate you. Remember, any product can cause an unexpected reaction or irritation. So it's really best to do a patch test where you're testing a small amount of the product on your arm, under the surface of your arm, perhaps on your neck. Just don't put it on your face yet. And definitely don't put it in the area around your eyes, which is the thinnest skin area of your body. I strongly recommend with eczema, with psoriasis, with a lot of these dry skin conditions, that you exercise because it decreases your stress level. So in conclusion, sometimes dry skin is a symptom of a medical issue, like a vitamin B deficiency, or a condition like eczema that's typically genetic or heritable. Make sure you see a board-certified dermatologist if you suspect an underlying skin condition, because many of them can be treated. They're chronic, but they can be controlled. Oftentimes, it's just your genetics plus environmental factors. Be gentle with your skin all over your body from your head to your toe, and hydrate, hydrate, hydrate.